Hello and welcome to today's lecture on health promotion frameworks. Today's lecture will discuss the methodology behind health promotion and disease prevention in public health. We will learn ways in which the levels of prevention are used to establish health promotion at the individual and community levels, then identify and define health behavior change theories used to enhance the health and well-being of the community. Lastly, we'll talk about the role of public health nurses in health promotion and prevention. Health promotion. In public health, health promotion encompasses the entire community, those living in neighborhoods and cities, and the individual or family. Health promotion is the process of enabling people to increase control over and improve their health. Remember, the client needs to take responsibility for their own health. However, health and well-being mean different things to different people. Please view the short YouTube video on people's perceptions of physical and mental health. After watching the video, how would you define health and well-being? The definition of health on the slide comes from the World Health Organization. Health is defined as a state of complete physical, mental, and social well-being, and not merely in the absence of disease or infirmity. This should sound familiar as we discussed the definition early on in the semester. This definition goes back to our perceptions on how we manage chronic illness. For example, someone who is a well-controlled diabetic, eats right, and exercises can still be in a state of good health and well-being, in comparison to another diabetic who eats poorly, is sedentary, and is suffering complications of the chronic disease because they do not manage their diabetes. Wellness is a subjective perception of full functional ability as a human being, subjective in the way one experiences things in their own mind or their perceptions. There is a cognitive and biological relationship between health and a person's sense of wellness. Health promotion, disease prevention, and risk reduction are some of the main core activities of public health. These key or core components provide essential input into interdisciplinary programs. They are used to evaluate health trends and risk factors among communities. The components promote health and risk reduction by working with communities or specific populations. Lastly, they assess and evaluate healthcare services that are beneficial to the promotion of health and well-being. The 10 key components of public health are mentioned in this chapter, but not directly displayed. The CDC website provides this information. See the link at the bottom of the page for more information on the topic. The key components are central to keeping the public safe and healthy. Promoting the health and wellness of communities and populations depends on integrating the components simultaneously into health promotion programs. You do not need to know these for the final exam, but please review them for your own learning. The 10 key components of public health continued on this slide. Again, the resource is located at the bottom of the slide. Healthy People Initiatives. Healthy People 2020 is a set of objectives established here in the United States to keep individuals, families, and communities or populations safe and healthy. Healthy People 2020 guides nurses in community health promotion. Box 5.1 of your text lists some of the most current added focal areas for Healthy People 2020. Currently, there are about 42 topic areas. If you explore the link provided in the slide, you can see all of the new topics. The inclusion of these new focal areas assists in reaching the two primary goals of increasing healthy years of life and eliminating barriers to accessing care, specifically through health disparities. Understand that reaching these goals and promoting change is based on evidence-based practice. Research has been done that supports the need for health promotion and changing health behaviors. Roadmaps to health promotion. The road to prevention is paved by modifying risks and preventative measures. The epidemiologic model is used by the community health nurse to address modifiable risk factors and establish interventions. Modifiable risks are the susceptibility to disease or injury that can be controlled by individuals, people, families, or communities. Examples of modifiable risks include diet, obesity, and sedentary lifestyle. Levels of prevention are used to establish health promotion activities within the community or at the individual level and can address some modifiable risks. Health promotion is an action or effort that supports the well-being of individuals, groups, and communities by reducing the risk of illness and injury. These activities or actions are labeled as preventative because they are directed at eliminating or reducing the impact of disease. The term disease can refer to either communicable or non-communicable disease. Preventative levels include primary, secondary, and tertiary prevention. These will be discussed more in detail in the next few slides. Primary prevention. Primary prevention is maximizing the health and wellness through strategies that are set in place before the illness or injury is present. Before is the key word. Primary prevention strategies include promoting good hygiene and good nutrition, smoking cessation, immunizations, and health education. Immunizations are one of the best examples for protecting individuals and populations from communicable disease through primary prevention. A common role of the community health nurse is to provide immunizations. Forward to the next slide for more discussion on immunizations. Immunizations and immunity. Something you may have learned along the way and is probably a review for you is the concept that immunity to disease results from the presence of antibodies to that disease. There are two types of immunity, active and passive. You should know these. Active immunity occurs when exposure to the actual live organism triggers the immune system to produce antibodies to that disease. Exposure results in natural immunity, or immunity can be through a vaccination, which is exposure to a dead or weakened form of the disease organism. The person comes into contact with the disease. The body reacts and produces antibodies to fight it. Active immunity can be lifelong in some cases, but the downfall is that it may take weeks to develop. Passive immunity. Here, immunity occurs when the person is given antibodies to a disease rather than producing them. A newborn infant acquires passive immunity from its mother through the placenta, or it can be given through immunoglobulins. Protection is immediate in passive immunity. Although immediate, it is often short-lived, lasting only a few weeks or months. Secondary prevention. Secondary prevention is maximizing the health and wellness through strategies that are set in place during the early stages of illness or injury. This is a planned effort to minimize the impact of disease or injury once it has occurred. Secondary prevention methods include screenings such as TB testing for hospital employees, screenings for lead exposure, checking heights and weights, vision and hearing screenings. Secondary prevention continued. When the public health nurse plans health promotion measures utilizing screenings, there are some elements to consider. These elements include whether the screening is cost-effective, the ease of use of the screening, the availability of the screening, the sensitivity and specificity of the screening, and whether the screening is acceptable to the population. Sensitivity refers to or measures the test's ability to correctly identify people who have the disease. Specificity measures the screening's ability to identify those who do not have the disease. You can see why these elements are important to consider when planning secondary prevention. Moving on to tertiary prevention. Tertiary prevention is maximizing the health and wellness through strategies that are set in place during the recovery of an illness or injury. Think of tertiary prevention as the long-term management and treatment of patients with chronic disease. Tertiary preventative measures attempt to maintain the quality of life in the presence of chronic disease. Some examples of tertiary prevention measures include exercise rehabilitation, support groups, nutrition counseling, and administering medications to treat the chronic disease. Nurses in community or public health should be aware of the resources that are available to address all prevention at all levels. Practice time. True or false? Tertiary prevention is maximizing the health and wellness through strategies that are set in place at the early and active chronic stages of illness and injury. If you said this question was false, you're correct. This is describing secondary prevention. Tertiary prevention would be maximizing the health and wellness through strategies that are set in place during the recovery of an illness or injury. All right, moving on in our lecture. Behavior models. For the remainder of the lecture, we will be discussing behavior models. The following is a list of behavior models from your textbook starting on page 92. Please take the time to read over all of the behavior change models in your textbook. You will need to know them for the future. The models include behavior change model, learning model, health belief model, trans-theoretical model, the theory of reasoned action, social learning and social cognitive theory, and finally, the relapse prevention model. First, the behavior change model. The behavior change model assists clients, groups, and communities to redirect activities toward health and wellness. Behavior change can be influenced by social, economic, and biological factors. How does one bring about change using the behavior change model? One method is motivational interviewing. Motivational interviewing is a client-centered communication style for eliciting a behavior change. Motivational interviewing assists clients and groups in exploring and resolving any ambivalence to change. Ambivalence means uncertainty to change or inability to make a healthy choice for change because of positive and negative feelings towards the action. The motivation comes from the client and should not be imposed by the clinician. Persuasion only leads to an increased resistance to change, and arguing, giving advice, or using coercive tactics may have negative outcomes as well. Next on our list is the learning model. The learning model was developed by Skinner, a predominant figure in American psychology. The model emphasizes reinforcement of social competence, problem solving, autonomy, and sense of purpose. Within the model, health behaviors are seen in increments or stages toward a goal. A goal is established and reinforced by the nurse with rewards given for partial accomplishments. Reinforcement is used to motivate the client toward continuing or discontinuing the behavior. An example of the learning model that you may be familiar with is Weight Watchers. Weight loss is rewarded with public recognition. People work in stages or increments toward a goal. And the program emphasizes social competence, problem solving, made through, for example, food choices, autonomy, and a sense of purpose. Within the learning model, there are different types of rewards. The two different types are extrinsic and intrinsic. Extrinsic rewards use praise, encouragement, and prizes to obtain or achieve the goal. These factors are helpful in the initial adoption of the behavior change. Intrinsic rewards. These are the feelings of accomplishment, changes in personal health habits. Intrinsic rewards are thought to be more beneficial for long-term behavior change. And this is what Weight Watchers uses. Who knew? Can anyone think of any other programs out there that may utilize the learning models? One that comes to mind for me is the Alcoholics Anonymous. The downfall of the learning model is the expectation that intrinsic rewards, those long-term changes, will last over time. Unfortunately, this may not be the case due to economic or social choices that are available in the community. For example, you may have a diabetic client that has made all the changes and has benefited from extrinsic and intrinsic rewards, yet is unable to continue the process because they live in a food desert. This is, remember, typically an area in the city where only convenience foods are available and convenience markets or fast food. In addition, this client may lack transportation to get to the resources needed or lacks the funds to maintain the healthy behavior. The negative impacts can be related to Weight Watchers as well. For instance, those who do not have the reinforcement or support system stop going to the meetings or lose contact with the sponsor. The client could potentially revert back to their old eating habits, thus gaining back weight. A lack of reinforcement leads to decreased motivation. Our next behavior change model is the health belief model. This model utilizes cues to action or a precipitating force to encourage people to engage in healthy behaviors. Cues may include posting reminder notes to promote healthy behaviors, health promotion billboards in neighborhoods and communities. Actually, just last night doing some highway driving, there's an illuminated sign that tells you, one, how many deaths are currently in Ohio, and a second sign that pops up that says, hey, that seatbelt looks great on you. That is a cue that may precipitate you changing or engaging in a healthy behavior. There are also commercials that obtain positive messages regarding health. The health belief model's intent is health promotion. The client considers 4 main factors when contemplating a change. These factors may determine the success of the client. The factors include the severity of the potential illness or physical challenge, the level of conceivable susceptibility to the illness, the benefits of taking preventative action, and the challenges that may be faced in adopting the new health behavior. Cues are an important way to remind people of healthy behaviors. Critical to the health belief model is the belief that the cue or action can be accomplished by the. This slide depicts examples of the health behavior model and the cues to action. These cues can come in many forms as mentioned on the previous slide. The Apple Watch and Fitbit are modern cues that promote health for individuals. The Post-it notes are something that can be placed by the client where they would see it routinely. My favorite cue is the billboard describing how much sugar is in a bottle of pop. These cues can assist in facilitating behavior change. The trans-theoretical model is an approach to behavior change that involves timely readiness of the learner. The model describes change as a process that unfolds over time and progresses through 6 stages. We'll take a look at these 6 stages in the next slide. The 6 stages of the trans-theoretical model are as follows. Stage 1, pre-contemplation. This means there is no program scheduled and no intent to schedule the program. Stage 2, contemplation. No program is scheduled, but the intent is to start one soon. Stage 3, preparation. no identified program, but have taken steps to develop one. Stage 4, action. They've developed a program, and the intent is to sustain the program. And stage 5, maintenance. Have had the program for some time and intend to continue it. And stage 6, relapse. Had a program, does not have the program currently, but intends to be active with the program soon. Okay, this is in relation to starting a program in the community. A little bit later, we're going to relate the trans-theoretical model to making a behavior or a healthy behavior change. Okay, how does this relate to public health? A public health nurse utilizes this model to facilitate change in a public health program. A brief scenario will assist you in determining the stage of the program development. The scenario: the public health nurse is on a committee and has established a need for an urgent care center in an area of town. Because of this, data has been collected. Now, you're meeting with officials to facilitate planning and development of the program. Which stage would best describe this? Well, let's take a look at our options. Is it pre-contemplation? There's no program scheduled and no intent. Well, there is intent because they've identified a need. Contemplation, no program scheduled, but the intent is to start the program soon, possibly. 3, preparation, no identified program, but have taken the steps to develop. Yes, they're taking the steps to develop because the data has been collected, and now they're meeting with officials to facilitate planning and the development of a program. All right, now I want you to take a look at the YouTube video that's posted at the end of the slide. It explains this model in relationship to making a health behavior change. I think this explanation makes the model a little easier to understand than the one that your text provides, and is a bit more tangible for us. Okay, now that you have viewed the video, let's discuss the stages again. The pre-contemplation. Now remember, this is in relation to a behavior change, not a program change. Program change is focused on in your slide. Now we're talking about the behavior change. Pre-contemplation, not ready to change and unlikely to engage in the near future. Contemplation, getting ready to change the behavior, but may still avoid the change, still has the intent to change. Preparation, ready to engage in an action. Tell people that they want to change and taking gradual steps toward that change. Action, doing the behavior, such as exercising. Maintenance, maintaining the behavior, seeking support during this phase. Maybe joining a exercise class. Relapse, it's not discussed in the video, but this would be the return to that pre-change behavior. And possibly sometimes it's due to a stressful event. So if we're relating this to exercise, that person would go back to sitting on the couch and watching TV. Think of how you could relate this theory to the process of changing a smoking, drinking, or drug-related behavior. Another example of the trans-theoretical model with visuals on the stages: pre-contemplation, contemplation, preparation, action, maintenance, and relapse. So I'm thinking about exercising, but I'm really not doing anything about it. Then I go into contemplating. I'm getting ready to change, but still not doing it. Preparation. I'm getting ready to engage in the action. I go out and I buy new tennis shoes, telling people that I'm going to start exercising, taking those steps. The action is I actually went out and ran or walked or did an exercise class. Maintenance, maintaining that behavior, that exercise. And then relapse again, going back to sitting on the couch and watching TV and not exercising at all. Please, if you do not understand these theories, you need to come and see me. All right, the theory of reasoned action. The theory emphasizes a person's behavior is primarily determined by his or her intention to perform that behavior. The model examines the relationship between attitudes and behavior. The intention is determined by the person's attitude toward the behavior. The ability to perform the behavior is a critical aspect of the change process. In the theory of reasoned action, social and subjective norms. These are the beliefs about what others think the person should do are significant in obtaining the goal. Reasoned action relates to the theory of self-efficacy. You may have heard me mention this at one time or another. This is the belief that one is capable of achieving a certain goal, or it is the perceived control over the skill needed to perform a behavior change. The attitudes and beliefs are related to the intention toward the behavior change. For example, in drug addiction, if a person believes that they can not give up the addiction, they tend to isolate themselves, that social aspect. Therefore, social norms cannot influence the behavior change. Intentions drive the behavior, or attitudes influence the behavior change. However, if the person believes they can quit, knows of others that have achieved the goal, and attends a support group, they are more likely to achieve that goal. Here, a positive attitude influences the behavior change along with those social norms from the support group. The video describes the theory of planned behavior in relationship to purchasing a cell phone, but I think the concepts here can relate to health and the perception of attitudes and the beliefs to make the change. From the video, you can see how social norms influence change and how health information can be overwhelming. This is why providing health education and supporting healthy behaviors is so important in accomplishing that goal. Anyone still scratching their head? These concepts are abstract. Just remember that behavior change is influenced by attitudes and the ability to change. The social learning theory is a behavior change model that considers environmental influences, personal factors, and behavior as key components to change. People, or the client, must motivate themselves and guide their behavior by goals and challenges they set. The person must believe that they are capable of achieving the goals. Again, this relates to self-efficacy and the perceived incentive to do so. Role modeling healthy behaviors or peer pressure may actually assist in motivating the individual or group to commit to the change. The relapse prevention model is used to primarily assist people struggling with relapse and recovery from substance abuse. Your Harkness and DeMarco text uses it in another scenario, and for the purpose of understanding this model, we will focus on high-risk experiences. Please refer to page 96. Read over this as you will need to have a firm grasp on the concept. 5 reasons for relapse: negative emotional states, lack of coping skills, decreased motivation, stress, and high-risk experiences. A planning strategy in the realm of high-risk situations is important for successful implementation of programs, especially when it comes to harm reduction efforts. Your text provides an example. Communities interested in crime prevention and harm reduction may be aware that during certain months of the year there is an increase in crime, so they plan a community campaign. Develop a watch program in an effort to adhere to a behavioral change, which is promoting nonviolence within the community. The watch program will be activated throughout the summer months when crimes are more prevalent. Adherence to this program and community support of the watch program is key to relapse prevention in this high-risk scenario. If the people are not engaged and motivated to participate, then how can it be successful? Crime will still go up, death rates will still go up. Remember, the relapse prevention model can also be used in or applies to drug addiction. The role of the nurse in health promotion. Nurses are a part of an interdisciplinary team and are fundamental in health promotion accomplished through support, education, and advocacy for the individual, family, and the community. The nurse identifies modifiable risks through evidence-based practice or research efforts that have identified and proven how modification can improve health outcomes. The nurse understands and disseminates research that will significantly impact the health and well-being of communities and populations. Please take the time to read over the learning theories. In doing so, you will be able to identify just how health science has evolved using psychology, sociology, and ethical principles. That concludes our lecture for today. As always, if you have any questions, please come and see me. Have a great day.